This will be my critique video of head to toe. Badge. So good afternoon, Katrona. My name is Caitlin Jarvis, and I'm a practical nursing student from Durham College here to do your head to toe assessment. Is that okay with you?
Yes, it is.
Okay. I'm going to ask you a few questions just to collect some information. What I noticed right now is that you are awake, you're relaxed, and not in any distress or discomfort. I noticed no cyanosis or pallor when looking at the color of your skin. Can I ask you what brought you in today?
I've been having a headache for a couple of weeks.
Okay. Is there anything that you did to make it worse?
No, I don't think so.
What about anything you did to make it better?
I've been taking Tylenol.
Okay. And that seems to help?
Yes, it does for a little while.
Okay. Can you describe what the pain feels like?
It's like a dull throb.
Okay. So on a scale from 0 to 10, what would you rate it? 0 being no pain at all, and 10 being the worst pain you've ever felt?
I'd say about a 4.
And what would that number be right now?
2.
2, okay. Have you ever noticed any patterns time of day when the pain gets worse?
No, not really.
Okay, and how long has this pain lasted?
It's been on and off for about 2 weeks.
Okay. Do you know anything that might be causing the pain?
No, I don't.
Okay, so I'm going to complete a head-to-toe assessment and share the findings with the doctor. Previously, I had taken vital signs, and what I gathered is that your temperature is 36.5, and that's within the normal range of 36 to 38 for an adult. Pulse is 71, again within the normal range of 60 to 100 beats per minute. Your respirations is 17, that is well in between the normal range of 12 to 20 breaths per minute. Blood pressure is 118 over 78, and again within the normal ranges of 120 to 80 for an adult. Your oxygen stat was 98. Again, that's within the normal range of 96 to 100 for an adult. I'm going to do a quick orientation. I'm going to ask you a few questions. Do you know where you are right now?
Yes, I'm in the hospital.
Okay. And do you know the date and month we are in?
It's Friday, July 24th.
Okay. So I'm just going to use my pen line here. I just want you to look over my shoulder at the wall over there. I'm going to be shining a light close to your eye. Okay. I'm checking for the reaction of your eyes. Your pupils contracted as I move closer, and they dilated as I moved the light away. So I'm going to check one more time. Again, just look at the wall over my shoulder. Okay, perfect. Your eyes have accommodated appropriately to the light moving close. Okay, so I'm just going to inspect your upper extremities. I'm looking for symmetry, color, any lumps, any cyanosis, bandages, and I see none. I want you to grasp my fingers as tight as you can. Perfect, okay. So the grasp is equal bilaterally and strong bilaterally. So I'm just going to palpate your upper extremities and your chest. Any discomfort when I do that?
No.
Okay, perfect. There's no lumps, no bumps. Skin is dry and warm to touch. Now I'm going to check your capillary refill. Perfect. The skin blanched and returned back to pink within 3 seconds. I'm going to check your radial and brachial pulse. Perfect. Pulse is strong and equal bilaterally. Now I'm just going to be checking your chest for symmetry. And I see no cyanosis, no swelling, lumps. Your skin is intact. Your ribs are sloping down. Your elliptical thorax and costal angle is at 90 degrees. And your anterior diameter is 1/2 of your transverse diameter. Okay, so now I'm going to palpate your chest. Any discomfort?
No.
Okay. And now I'm going to use my stethoscope and auscultate your chest. Each time I move the stethoscope, just take a deep breath for me.
Okay.
auscultate into your chest, anterior and lateral chest. I heard good air entry and from the apex to the base of the lungs. Heard no wheezes, no crackles, or adventitious sounds. So I'm going to auscultate your heart. Okay, starting at the right side, second intercostal space of your right sternal border. Okay, I can hear S2 louder than S1. Okay, I'm going to move to your pulmonic valve. Second intercostal space of sternal border. And I can hear S2 louder than S1. I'm going to move to Erb's point. Third intercostal space. I can hear S2 equal to S1. I'm going to move to the tricuspid area. Fourth, fifth intercostal space, left of the sternal border. Okay, and I'm going to check your mitral valve, which is at your fifth intercostal space between mid-clavicular line. At this point, I hear S1 louder than S2. And this also is the point of maximum impulse. This area tells me information about your apical heart rate. I would listen to this point for a full minute. Based on your vitals earlier, there's no sign of concern. I would also use the bell of my stethoscope in the same fashion for any murmurs. I'm going to move on to your abdomen. Using my pen light, I'm checking for symmetry. Okay. So I'm going to auscultate your abdomen, listening to all four quadrants. I'm listening for bowel sounds in each quadrant. Starting in the right lower. If there were any tender areas, I would have left those areas to last. So your sounds are normal, gurgling sounds, 5 to 30 sounds per minute in each quadrant. So I'm going to palpate lightly. Any discomfort?
No.
Okay. Now I'm going to deep palpate down 5 to 8 centimeters. Any discomfort?
No.
Okay. No abnormalities felt, no lumps, no discomfort. At this point, if there was a Foley catheter, I would check the color, the amount of the urine. And I'm also checking for any dressings, ileostomy, colostomy. And when auscultating, I would have checked the iliac arteries, the renal arteries, femoral artery, checking for any abnormal sounds, bruits. Okay, so now I'm going to inspect the lower extremities. Okay, I'm checking for even hair distribution. The legs are equal bilaterally. Skin is warm, dry to touch. No swelling that I see. Now I'm going to palpate. Okay. Again, skin is dry to touch. No abnormalities, skin is intact. I'm going to check your pedal pulse. Okay, it is strong and equal bilaterally. Now I'm going to check the capillary refill of your toes. Okay, skin blanched and returned back to pink within 3 seconds, which is normal. There's no dressings on feet or legs. I want to check the strength. So just push back on my hands. Perfect. Okay, so strong bilaterally. I'm going to ask you to sit up. I'm going to check your posterior chest. Just face towards that wall a little bit there for me. Okay, so I'm just going to check that the spine is in line. Again, skin is warm, dry to touch. I've palpated for any lumps, bumps, or tenderness. Now I want you to take a deep breath in for me. Okay. Chest expansion is symmetrical on both sides. Now I'm going to auscultate your back using the Z pattern. I want you to take a deep breath each time I move the stethoscope. Okay, I hear good air entry, no crackles, wheezes, or adventitious sounds, and I've checked from the apex to the base bilaterally. Okay, you could turn and face me now. So at this point, I'm just going to let your doctor know the findings based on your head-to-toe assessment. And before I leave, is there any questions?
Nope.
Okay, so I'm going to leave your bed down in the lowest position. Have your bed rails down, your call bell close to you. Bed is also locked, and keep the area free of clutter. And I'm going to wash my hands and document. Thank you.